Well, who can forget these images? Children and families who flocked across the Mexican border by the thousands last summer, looking to start new lives right here in the United States. Many of them were taken into custody at facilities across southern Arizona. With our federal courts facing a major backlog, some detainees have been waiting for more than a year just to get their day in court.
Only on KWLD News 13, we have an exclusive look behind bars. Sonu Wasu asked Homeland Security officials if we could take our cameras inside the facility where the detainees are being housed, and she's now joining us with more on that.
We had to get clearance from the top levels of the federal government to get into the ICE facility. It is expensive business. According to reports we have obtained, the cost of federal detention, $164 a day for one detainee. Immigration advocates are calling for alternatives, saying it's cheaper and more humane for families struggling with the loss of a provider now behind bars.
As of today, it has been exactly 1 year, a month, and 8 days since they took my father away.
In these pictures, you see the face of a happy family man. He's been in the U.S. for almost 2 decades. But the troubled faces staring at our camera in this room are those of a family who say the arrest of Felipe Cobos Luna has torn their family apart.
I can't stand hearing him saying, "I'm sorry, I can't be there, but I promise you I will be back home soon."
ICE officials say Cobos Luna has been detained because of his rap sheet. Federal records show he's been deported twice and re-entered the country illegally. Like many others, his family wants him to stay at home while awaiting his deportation hearing.
All people in detention suffer a level of abuse and conditions that are really challenging.
After hearing numerous allegations of bad conditions, bad treatment, and lack of food, we asked Homeland Security officials if we could take our cameras inside an ICE facility to get a first-hand look at how illegal immigrants are housed.
We're not hiding anything. We're proud of our detention facility.
ICE officials asked us not to show the faces of detainees. In here, 80 different nationalities coexisting behind barbed wire. Majority from Central America, Guatemala, Honduras, and El Salvador. While driving around the complex, yes, it looks and feels like a prison. You will see the barbed wire, security cameras, uniforms, and dorm rooms that are called open pods. So we were surprised to hear
no one is here, being punished.
An ICE spokeswoman says the detainees have a lot more freedom than, say, a prisoner in a state or county jail.
They're fed 3 times a day. They have access to commissary items. We have snack machines.
We saw vending machines in every dorm room, large soda fountains in the cafeteria. Not something I've seen while visiting state and county jails. We are told every detainee is also allowed to keep up to $60 with them. Once a week, checks and money orders can be cashed. We saw multiple phones in every pod, also machines where detainees can buy phone cards. Inmates have access to laundry every day. In the rec yard, we saw a newly turfed soccer field and gym equipment. In the day rooms, 2 TVs where detainees are allowed to stay up until 1 a.m. on weekends and hang out. But immigration advocates say the complaints they're hearing are serious.
Lack of adequate medical attention.
We took this concern to the Department of Homeland Security. They walked us around their medical unit, which is staffed 24 hours.
Every morning, every detainee is asked if they're feeling okay, if there are any issues.
Doctors, nurses, and a dentist on hand every day. ICE officials sent me a statement saying, quote, they're committed to providing detainees with timely, safe, humane, and appropriate treatment, which includes medical and mental health care. Another big complaint from immigration advocates:
the food, for example, in certain detention centers not being adequate.
We asked officials if we could check out the day's lunch menu and take a trip into the kitchen. Amid the long, hungry crowd of detainees waiting to be fed, staff made me a plate. This is what detainees are eating. I took a bite and a sip. Tasted like corn dogs and chicken soup. Staff say they're serving up to 3,500 calories a day, and the food they're cooking is the same food fed to U.S. soldiers and military bases throughout the country. The feds use the same food vendor to save money. While it's definitely not home.
No one wants to be in detention. The common complaint is, when am I going home? When am I being released?
A question only a judge can answer. Unlike a prison, families are allowed to visit loved ones every single day, up to 3 allowed at a time.
When we talk on the phone, it breaks my heart to hear him cry and cry. to hear how all this is affecting him, especially mentally.
To lighten the load and free up more bed space, the Obama administration is now trying to speed up the court process and fast-track deportations, especially for those with violent criminal histories. Sonu Wasu, KOLD News 13, live, local, late-breaking.
They are our neighbors and our co-workers.
They are former inmates addicted to drugs. Many turn back to crime to feed their addictions, putting you and your family's safety at risk and landing them back behind bars.
But should you have to foot the bill to help them kick their habit? In a story you'll see only right here on KOLD News 13, Sonu Wasu investigates the drug addiction crisis in our prisons and what it's costing all of us.
Also known as Prison Row in Tucson, home to thousands of prisoners, convicted drug dealers, thieves, and murderers, now killing time.
I know you guys hear this place is great. People are lying, cheating, stealing, and killing to get in here, but no, I'm good. I have no desire to come back here.
It's been a revolving door for Sean Thompson. He spent almost half of his life locked up. But even before becoming a prisoner, Thompson was already trapped, bound by an addiction to drugs.
I did what they call the triple cocktail. I used to inject coke, heroin, and speed. I committed the crimes to support my habit.
After decades behind bars, Thompson is one of more than 1,000 prisoners, now a successful graduate from the Department of Corrections Substance Abuse Program.
If you want it bad enough, you can achieve it.
He now serves as a mentor and counselor for others like him, and there are many.
We have 75% of our folks coming in the door assessed as needing substance abuse treatment.
The price tag may be hefty, but studies are showing treating the addiction that led most inmates into prison is slowing down that revolving door. Inmate Brian Lawrence is still a work in progress.
My actions while drinking had brought me here. I'm just, tired of being a village idiot and drinking and coming back, back and forth to jail.
For many of these hardened men, opening up can be a challenge.
Part of it's a calling for me.
It takes dedicated licensed counselors to cut through the hard shell.
They're easy we lock them up and it can be easier just to forget them.
But state prison officials will tell you it's taxpayer money well spent.
They're going to be your neighbors. They're going to be living in your neighborhood.
The substance abuse treatment program also teaches inmates re-entry skills, preparing them for life on the outside. For many, it's a tough transition.
Do you ever crave alcohol while you're here?
Sure. It's not... I'd be lying if I said I didn't, but from a realistic point of view, it's do I want to come back here? Alcohol equals coming back, so...
Sitting in prison, it's not a life. It's existence, but it's not living, and I'm ready to live.
Statewide, about 800 inmates are enrolled in this substance abuse treatment program right now. To find out more, you can go to our website, TucsonNewsNow.com. Reporting live on the east side, Sonu Wasu, KOLD News 13, live, local, late breaking.
And the recent measles outbreak is putting the spotlight on parents now who refuse to vaccinate their children. Here in Arizona, the state health department has seen 7 reported measles cases. 2 of them in Maricopa County, 5 of them in Pinal County. But the good news so far, no cases have been reported in Pima County. However, medical experts say it's only a matter of time. KOLD News 13 Sonu Wasu is live with a look into this vaccination debate tonight and how it could impact the health of your child. Sonu?
Yeah, Heather, it is a small group of parents who choose not to vaccinate their children, but medical experts say their decision has a big impact on public health. In Arizona, by law, parents have the right to choose not to vaccinate their kids. Check out these numbers. In the last year, more than 4,000 parents in Arizona filed for a philosophical exemption. About 275 parents filed for a medical exemption for their kids, and that is about 5% of the child population here in the state. I spoke to one of those moms tonight, and she tells me she's done a lot of her own research, and she stands behind her decision not to vaccinate. 3-year-old Noah and his 5-month-old baby sister Hannah are 2 of many Pima County children who have never received a vaccine. Mom Brittany Archuleta says she made the decision after doing a lot of research.
There's no proof that it works.
Archuleta knows her decisions draw a lot of controversy, and she feels the social stigma of being a parent of unvaccinated children.
There are some places that won't let your children come if they're not vaccinated, daycares and things like that.
Her decision is based out of fear for her children's safety, worried that vaccinating her children could lead to devastating side effects.
I trust my children's immune system. I believe that we were made perfectly the way that we are. I wouldn't mind my children getting these things. I mean, because that just builds their immune system. Getting sick is natural and it's okay. I mean, and I'm sure you can't put this on, but as a Christian, I trust that God's will be done, you know, that He made us just perfectly, and if they get sick, that's what's supposed to happen.
That's just irresponsible. I mean, that kind of borders on child abuse. There's no reason not to have your children vaccinated anymore.
A few miles away, we found this mom who says she rushed to vaccinate her kids and grandkids as soon as she could.
I don't think it is dangerous, and I think it's been proven that it doesn't cause any issues with, or any medical issues with kids.
We took the question to medical experts. Dr. Sean Elliott, the medical director of infection prevention at the University of Arizona Health Network.
Do kids who are not vaccinated pose a risk to other children?
Yes.
And Dr. Francisco Garcia, director of the Pima County Health Department.
It's unfortunate because that has repercussions for other children.
Medical experts tell us while parents have a right not to vaccinate their kids, these children can pose a challenge for the school system and for public health. For example, in the Vail School District, every unvaccinated child had to be sent home during a whooping cough outbreak about 1.5 years ago. Parents like Brittany argue there's no way to prove vaccines work.
If the vaccines are protecting you, why are you afraid of my unvaccinated child? Obviously, you don't believe that they're very effective.
While most parents stand behind the science and advice they're getting from the family doctor.
As a medical professional, I live by science. The one way to protect yourself is to get the vaccine and get it yesterday.
Vaccination is probably the single most important thing that we can do, that I can do as a father to protect my 2 boys.
I'm more afraid of the children who are vaccinated than of the children who aren't, because a lot of these vaccines are live. That means that they shed the virus for weeks after being vaccinated. I definitely will not be changing my mind about it.
Now, we checked, and Pima County does have a high rate of vaccinations. According to the school districts and the health department, about 93 to 95% of kids here in Pima County have received vaccines. Districts are required to turn in their records to the health department. The challenge we're hearing is mostly kids in private, parochial, or charter schools, also those who are homeschooled. Reporting live, Sonu Wasu, KOLD News 13, live, local, late breaking.
All right, thank you so much, Sonu. And if you would like to get your child vaccinated, there are several places to do that here in southern Arizona, and big bucks.
As the city grows, the roads seem to be crumbling. Whether you hit a pothole or not, everyone's paying for it.
Only on KOLD News 13 tonight, Sonu Wasu investigates Tucson's pothole problem. Sonu?
Yeah, Heather, Dan, people get so fired up about this. Tucson potholes actually have their own website and their own blog. One frustrated driver I spoke to actually compared the surface of Tucson streets to the surface of the moon, covered with cracks and craters like these we found on Holly Road off Speedway. And this rocky ride has not been cheap for you, the taxpayers.
Well, it's the Super Bowl. It's a rattling ride that's shaking up nerves.
Oh, it was jarring, like worse than the worst turbulence you have in an aircraft.
Putting a dent in drivers' pocketbooks.
I hit a pothole near Grant and Dodge, and it was so severe, the car practically jumped up in the air.
I was near Drockman, and I just ran into this monster pothole on Stone Avenue. Turned out that pothole I hit cracked a rim on my car.
While drivers are seeing red. Frustrating?
Very frustrating.
Tire shops are seeing green.
Every day we get people that come in that hit a pothole.
Damage that can cost you anywhere from $100 to $500. Thanks to good documentation, Jeremy Christopher made sure the city paid for his new wheels. $450 refunded.
The city, no questions asked, they sent me a check.
But that's because Christopher made sure he had all the paperwork. We checked in with the city's risk management department asking what type of proof a driver should have. Here's what we learned. If your damage estimates are more than $1,000, the city requires 2 estimates, photos of the damage, a location and time of loss, so the city can review the area. Risk management will then conduct an internal review before writing you a check. But why are the roads so bad? We stopped by the city's transportation department and sat down with the man in charge.
You're the transportation director. You drive that road to work every day. What are you thinking as you drive it?
We got to do something.
And Cole adds, they have been. Pothole crews are out 5 days a week working all over the city. We asked the city if we could follow them around and see what they do. We tracked down this crew working off a very bumpy street road near Speedway. After all this labor, hopefully a smoother ride for drivers. But how long will this quick fix last?
Is that a Band-Aid fix?
Absolutely. The emotions and aggregates it's a Band-Aid fix. It's not a long-term permanent patch, but you're getting years of service out of it.
That brings us to Grant Road. Even the transportation director admits
that's one of our worst roads in the system.
Tucson voters passed Prop 409 in 2012, giving the city access to $100 million to repair the rough roads. Long-term solutions for Grant Road include a complete widening, also a new surface, but that could take years. Until then, short-term fixes are taking place to smooth things over temporarily.
We're going to take that off of our worst list and to be one of our better streets here by, say, this next summer.
Now, in the last year, the city has received more than 2,000 pothole complaints from residents, many who say city potholes ruined their wheels, and that has cost the city more than $30,000 in the last 2 years. That's how much they've shelled out to drivers who have successfully filed claims. And in order for you to get paid, the pothole needs to be logged in the city's computer system. So it's extremely important you call it in. City officials tell us they'll try to get a crew out to fix it, ideally within 3 weeks. Now, we've got a link for the Prop 409 pothole repair timeline posted up for you on our website. That's TucsonNewsNow.com. You can see how much the city has already spent, also where they'll be working next on that website. And to find out how to report a pothole to the city, we've also got the city's pothole hotline number posted for you up there on our website as well. Sonu Wasu, KOLD News 13, live, local, late breaking.
All right, thank you so much.